Welcome to This Explainer. Today, we are equipping you with the exact basic life support steps straight from the American Heart Association. If you've ever wondered, what would I actually do if someone just collapsed right in front of me? Well, you're in the right place. We're going to build up your confidence today so you can act decisively during a cardiac emergency. Okay, here's our roadmap for today. We'll be covering 1. The chain of survival, 2. First steps in emergencies, 3. High-quality chest compressions, 4. What are rescue breaths, 5. Using the AED, and 6. When to stop CPR. Section 1. The chain of survival, your procedural roadmap. So the entire medical system depends incredibly heavily on what happens before the ambulance even gets there. If just one link in this chain of survival is broken, the chances for a good outcome absolutely plummet. But before we jump into action, we've got to ask a critical question to clear up a really common misconception. Is the victim having a cardiac arrest or a heart attack? People use these terms interchangeably literally all the time, but medically and practically, they are very, very different emergencies. And this difference is absolutely critical. Think of a heart attack as a plumbing issue. A clot forms, blocking oxygenated blood from getting to the heart muscle. The person is usually awake, right, and they're experiencing severe chest discomfort. Now, sudden cardiac arrest, on the other hand, is an electrical problem. The heart's rhythm just goes chaotic, it quivers, and it completely stops pumping blood to the brain. The person will literally collapse within seconds and stop breathing. Fast action here is the only thing that saves lives. Section 2. First steps in emergencies, recognizing the stakes. All right, if you find someone collapsed, you've got to follow this strict if-then framework. First, verify the scene is safe. Look around. You can't help anybody if you end up becoming a victim yourself, right? Second, check responsiveness. Tap their shoulder firmly and shout, "Are you okay?" And third, if you get no response, shout for help. Direct a specific person to activate the emergency response system, like pointing and saying, "You, call 911," and tell them to grab an AED immediately. Now, while you're waiting for help to arrive, you need to quickly scan the chest for normal breathing and simultaneously check the carotid pulse right there in the neck. Keep in mind, and this is important, occasional agonal gasping, which might sound like a snort or a groan, that is not normal breathing. It's actually a massive red flag. It is a sign of cardiac arrest. You want to make this assessment quickly, taking at least 5 seconds, but absolutely no more than 10 seconds. Section 3. High-quality chest compressions, pumping the blood. Okay, so if you don't definitely feel a pulse within those 10 seconds and there's no normal breathing, you've got to immediately start high-quality chest compressions. You are now literally the pump for their heart. Make sure the person is face up on a firm, flat surface so your compressions actually squeeze the heart instead of just mashing their body down into a soft mattress. And to effectively pump blood to the brain, you've got to push hard and fast at a very specific rate, 100 to 120 compressions per minute. That's the universal rate across the board for all cardiac arrest victims. But hey, speed isn't the whole story. Depth matters just as much. To make sure that blood actually makes it all the way up to the brain, you have to compress the center of the chest right on the lower half of the breastbone to a minimum depth of 2 inches or 5 centimeters for an adult. I'm not gonna lie, it's really hard physical work, but it is just absolutely essential. You also have to make sure you take your full weight off the chest between each compression. Why? Well, because allowing that full chest recoil is what actually lets the blood rush back in and completely refill the heart chambers before your next push. If you don't let it recoil, you're just pumping a partially empty heart, which drastically reduces blood flow. Section 4. What are rescue breaths? Oxygenating the blood. So, what exactly are rescue breaths? We can define them as using a pocket mask or a bag mask device to manually oxygenate the blood for someone who just can't do it themselves anymore. And here's a pretty cool fact. The air we breathe in has about 21% oxygen, but the air we exhale still has about 17% oxygen. That is actually more than enough to give a victim the life-sustaining oxygen their tissues desperately need right now. To do this correctly, you've got to first open the airway, usually by doing a simple head tilt chin lift. Then, deliver each breath over exactly 1 second. You're not trying to blow up a balloon until it pops here. You just want to ensure you see the chest visibly rise. Give 2 breaths, and then get right back on the chest. This maintains our golden CPR ratio, 30 compressions followed by 2 breaths. Now, this is a really fascinating distinction you need to understand. Compressions alone can usually sustain an adult for a little while because their cardiac arrest is typically a sudden electrical issue and their blood is already full of oxygen. But the situation is completely different for kids. Rescue breaths are absolutely vital for infants and children. Their cardiac arrest is almost always caused by a secondary respiratory failure or shock, so their blood oxygen is already completely depleted by the time their heart stops, making those rescue breaths a non-negotiable lifeline. Section 5. Using the AED, restarting the heart. As soon as the automated external defibrillator, or AED, arrives on the scene, you enter the next crucial phase of the chain of survival. The AED is this brilliant computerized device that identifies lethal heart rhythms and delivers a shock to basically reset the heart's electrical system. And don't let the machine intimidate you. Operating one is super simple if you follow these universal steps. First, just power it on. Some literally turn on the second you pop the lid open. Second, peel and attach the adhesive pads directly to the victim's bare chest, just following the little pictures right there on the pads. Third, loudly clear everyone away and let the machine analyze the rhythm. And finally, if it tells you a shock is needed, clear the victim again and push that flashing shock button. You do need to be ready to quickly handle a few special circumstances. Water conducts electricity, right? So pull the victim out of any puddles and wipe their chest dry. If their chest is super hairy, the pads just won't stick, so use the little razor that comes in the AED kit to quickly shave the area. If you see a hard lump under the skin that looks like a pacemaker, just place the pad slightly away from it. And if they've got a medication patch exactly where a pad needs to go, throw on some gloves, peel off the patch, and wipe the area clean. But here is the absolute golden rule for the AED. Immediately after a shock is delivered, or if the machine tells you no shock advised, you have to resume chest compressions without a single second of delay. Don't stop to check a pulse. The heart desperately needs your manual pumping right away to start recovering. Section 6. When to stop CPR, the exit strategy. So when do you actually stop? The specific parameters for stopping CPR are crystal clear, so you're never left second-guessing yourself in what is, let's face it, a highly stressful, chaotic situation. Once you begin, you must strictly continue those cycles of 30 compressions and 2 breaths. You only stop for 2 reasons. Number 1, advanced life support providers, the paramedics, arrive, get set up, and explicitly take over the scene from you. Or number 2, the victim actually begins to breathe normally, move, or otherwise react. What if you get exhausted? You don't stop. You quickly switch out with another rescuer every 2 minutes while the AED is doing its analysis. You have to keep that chain of survival intact. Well, we've covered the critical differences between heart attacks and cardiac arrests, the exact metrics for high-quality compressions, exactly what rescue breaths are and why they matter so much, and the strict rules for when to stop CPR. Here is the absolute most important takeaway from this explainer. The worst thing you can do in a cardiac emergency is nothing. Your hands are quite literally the only thing standing between a victim and irreversible brain damage in those critical first few minutes. So are you ready to be the strongest link in the chain of survival? To stay prepared and empower yourself, hit that subscribe button to watch more life-saving explainers just like this one. Stay curious, stay ready, and we'll catch you next time.